Hello everyone, today let's discuss about periodontal flaps. So what do you mean by periodontal flaps? By the definition, a section of gingiva and mucosa reflected from underlying tissues to provide visibility and access to bone and root surface. Suppose if there is a lot of plaque accumulation around the root area and also some bony defect around the bony area. So in such cases, access to clean that area would be difficult. So because of that, we need to do some kind of reflections so that we get accessibility and visibility to these areas. So this is basically known as periodontal flaps. And now we need to see which all are the objectives of periodontal flaps. As I mentioned now, access for root instrumentation, gingival resection, osseous resection, and periodontal regenerations. Now let's go into the classification of periodontal flap. It is divided into three based on different criteria. First is based on the bone exposure after reflection, divided into full thickness and partial thickness flap. By the name itself, we'll understand that full thickness flap means we are going to remove everything. That means we are going to remove the connective epithelium, connective tissue, and also the periosteum. And then we need to we can work on the bone area. Whereas in the case of partial thickness flap, we are not going to remove everything. We are not going to touch the periosteum and some of the connective tissue. So if you see this picture, this is the partial thickness flap and this is the full thickness flap. And next, based on the placement after surgery, it is divided into non-displaced and displaced flap. Non-displaced means after the reflection we are not going to remove any modifications. That means we are going to suture it back to the original position, especially in the case of modified Whitman flap. If you see this picture, they have reflected the flap and then suture it back to the original position. Whereas the displaced flap means, so in certain circumstances we need to move the flap apically and coronally and laterally. I think you are clear with these two. And next is based on the management of the papilla. It is divided into conventional flap and papilla preservation flap. Conventional flap means the interdental papilla is split beneath the contact area. This is if this is a contact area, and we are going to split the interdental papilla beneath the contact area, and then we can move that into the facial papilla into facial flap and the lingual papilla into the lingual flap. This we used very before, but recently they have they are doing this papilla preservation flap. That means the entire interdental papilla, you see this picture, the entire interdental papilla is incorporated in either the facial or the lingual flap. So this is all about the classification. And next we will see the principles of flap design. Usually the proper flap design prevents the complications of flap surgery. The complications are the flap necrosis, descents, and tearing. Now let's see how to prevent the flap necrosis. First one is that the base of the flap, if you see this picture, this is the base of the flap, this is the height of the flap. Actually, this height of the flap should be less than the base, means the base has to be wide enough so that they get the good blood supply to the flap, and so less chance of flap necrosis. So let's consider this this base of the flap is x and the height is y. The x should be x equal to y. I think you are clear with this. And next is the other important point we need to consider is that the sides of the flap should be parallel to each other, or it has to converge from the base to the apex, not like this. If the incision or the side of the flap is like this, means it can cut off the blood supply to this part of the flap and can lead to necrosis. And other thing is that whenever it's possible, try to keep the base of the flap towards a major blood supply. For example, in the case of this palatal area, the flap should be based towards the greater palatine artery if possible. And the other thing is, during the surgical procedure, sometimes we may pull or crush or fold the flap. That must be avoided because the nerve supply can compromise and it can delay the healing. And next we will discuss how to prevent the flap dehiscence. So this is like the opening of the surgical wound edges that exposes the bone. If condition goes like that, means it can lead to pain, bone loss, and increases scar tissue. And the other thing is that how to prevent the flap tearing. Suppose when we do perform a surgery, but the flap is giving us insufficient access, so we try to retract so much. In such cases, it can lead to flap tearing. So these all we must avoid. Other point to consider is that the flap margins must lie on sound bone. That is really important, not the defect bone. Otherwise, it can avoid so that to avoid unnecessary dehiscence post operatively. That is really important. And the other thing is that the incision over the bony prominences must be avoided to avoid the flap being closed under tension. If the flap being closed under tension, it can exert more pressure on the wound. A suture that lie on healthy bone can lead to the primary closure of a healing. So for a flap, definitely we aim for the primary closure than the secondary. So this is all about, this is just the introduction to flap surgery. In the coming videos, I am going to upload, going to talk about each and every type of flap, so that you'll understand everything in detail. I think you are clear with the introduction, and thank you.